Hi everyone, I'm Dr. Grisales. For many years we have treated patients with opioid medication, but more recently we have come to the conclusion that it was not a good idea. We have seen a lot of problems that have come through the years, and research has been done in regards to the effects of the opiates. We have found a big problem in terms of tolerance and how these medications require higher and higher doses to be effective. We have found why, and this is the point that we have to start decreasing the medication because it's not taking us to anywhere but trouble. Pan American Pain Institute and myself, as director of this institution, are trying to do the best to decrease the patients to the point where they really benefit from these medications and we don't go into bad trouble with them. Years ago, we started treating the patients with the opiates, and we observed that little by little patients started to come back presenting the same levels of pain, and we increased the dosing. That was done for many years until we realized that there was a problem with this. Very recently, the Centers for Disease Control, CDC, came out with guidelines that initially were for primary care physicians. These guidelines were initially given to give a little bit of notion to the primary care providers about the management of these opiates. However, we as pain specialists have adopted that regulation and that guideline also as our guideline because we have seen that these medications indeed cause a lot of problems. So that's why we're reducing the dosing little by little on all our patients to get the patients to the level that the CDC recommends. The recommendation basically is going to help a lot of patients that have developed what we call the hyperalgesia, or a problem that emerges when the body has created a lot of receptors. The patients feel a lot of pain all over the body, and not only in the areas of pain that they had before taking these opiates. Besides that, patients suffer with cramping and a lot of abdominal pain and diarrhea. Those are the symptoms of withdrawal. But it's not only withdrawal what we think of, it's just that basically the proliferations of these opioid receptors create a lot of these problems. So to improve the patient's health in general, we are following these recommendations like all the other centers in the country that are interested in the well-being of the patient and not just in making money. So Pan American is committed to that, and thus we are going to continue decreasing the pain medication until the patients really feel that they produce the adequate benefit.